Good morning, everyone. I just want to thank you for being here. It's truly an honor to be able to present ideas to like-minded peers. I just want to ask how many students are here today? All right, that's good. That's exactly what I was hoping for. So thank you again, and happy Veterans Day. I appreciate everyone's honor and time in the service. So my name is Claire Wilson. I've been working in healthcare for over 4 years. In the past 2 years, I've worked in 15 different states to advance my knowledge of the HTM field. Today, I will be discussing skill sets for career advancement and professional communication. Please remember, talent and knowledge can be severely overrated. Discipline, attitude, and willingness to learn can outweigh your lack of experience. Every person has understood the feeling of not being prepared for challenges they encounter in life. Aligning your life goals with your accomplishments will promote a positive career. Your career benefits people's lives through their worst moments. We improve the quality of patient care by maintaining equipment that is used to save lives and support modern medical practices. Except that having to learn new things will never end. Sometimes the best thing to do with a repair is to take a break and try again with a fresh thinking process. Peers, manuals, and tech support can really give you a fresh perspective. Most HTM professionals start their BMET career through previous healthcare jobs, internships, training, college, high school programs, trade schools, military careers, and degrees. Those are just limited things though. There's many people that have started the field in a non-traditional way and they've succeeded. When you start at a hospital, there's definitely staff you want to familiarize yourself with. Charge nurses, nurse managers, facilities, IT, EVS, equipment teams, respiratory techs, and therapists, and all our staff tend to be the people that you will need to communicate with when you remove equipment, when they need updates on shipments for parts and stat repairs. So you never want to tell the customer that you can fix a device that you're not trained on or comfortable fixing. Please don't feel any pressure from management to do something that you're not trained on, because that can lead to a lot of problems. Here are some statements that can be said to the customer to ensure professionalism and to protect your career. This repair requires more research. I will escalate this to a senior technician or management. This requires vendor service that cannot be performed by in-house techs. This device requires new parts, and I have no expected ETA. I have no expected ETA for the shipment. I will keep you updated. Please remember that parts can be on back order for months. It is growing more common for parts to be discontinued faster than ever. It's important that all healthcare professionals understand the risks of major events with both patient and staff safety. Standards must be maintained to improve healthcare for everyone. Here's what to expect during challenging moments in your career. Patient incidences occur when a patient is hurt or perishes from malpractice of a hospital employee. Patients can also suffer when equipment malfunctions. Accurate records of all work orders is your best protection during a legal situation. During a legal investigation, all PMs, repairs, and troubleshooting will be reviewed. Error logs are crucial to indicating how a device harmed a patient, whether it's a wrong dose of medication, extreme temperatures, missing alarms, allergic reactions, failed assistance during a lift, or a complication during surgery. Recalls and training are essential to avoid the incident happening to someone else. Manufacturers must document all equipment errors to avoid harming patients and staff. Equipment is standardized based on these events, and advancements are created every day, and we're seeing the future happen before our eyes. Starting in the 1800s, patient safety organizations began to advocate expectations both nationally and internationally. Patient safety organizations evaluate the conditions of building structures, electrical codes, plumbing systems, fire safety, infection prevention, case management, the age of equipment, and many more. And here are some of the largest patient safety organizations and when they were founded. So you have AMI, you have the American National Standards Institute, you have the DNV, you have Emergency Care Research Institute, and JCO, now known as the Joint Commission. Here are some of the most significant threats that can occur in a hospital. Equipment attached to patients during these times are a vital component that must be protected to maintain patient care and safety. Evacuations, power outages, severe weather, shortages of vital patient care supplies, and active threats within a hospital are some of the most common events that a technician can experience. During major events, this is what Biomed will be responsible for resolving. Bringing telemetry readings back when the system stops monitoring patients properly. If you do have sterilizers in your scope of service, they are one of the most critical pieces of equipment to the operating rooms, and the operating rooms cannot function properly until the machine is fixed. Life support equipment is categorized as ventilators, anesthesia machines, dialysis machines, defibrillators, infusion pumps, patient monitors, pacemaker programs, oxygen concentrators, nebulizers, just to name a few. And you will notice that closing out these work orders and ordering parts and the turnover time to repair these devices will look different. These devices are the most common. You will run into a patient incident, and so air logs, for example, pulled off of the Alaris software will indicate what happened. Certain times nurses will accuse equipment of alchemy, when in reality it was a lack of communication. Imaging systems are the fastest solution for internal diagnostics and the most intense devices to repair due to limited systems and complex repairs, with an even faster need for turnover time. Limited quantity equipment must have parts on site at all times to reduce turnover time. Recalls have a systematic process to remove equipment immediately from patient care, replace and add parts, run tests, and update records. If your hospital is having an inspection, they will ask you about these things, the amount of time you're expected to get a device off the floor when there's a recall, and the expected time frame for resolution within that. Complete extensive research before agreeing to maintain and repair lab equipment, sterilizers, decontamination washers, life support, and imaging devices. When these devices need repairs, they will become stat and can affect patient care. Most of the time when patient care is influenced by a lack of equipment being replaced or repaired, they are referred to different facilities or their care is canceled altogether. Biomed techs help to build a reputation of consistent care that people depend on for general medicine all the way to emergencies. Okay, so this is very important to choose the job that you love because it will impact the quality of your life. You put 8+ hours a day, it's 1/3 of your day, and so you want to make sure that you don't have fast burnout from the training that you receive and the equipment that you work on. So questions you can ask an employer when you're looking for a job is, will the company contract allow for you to have a second income outside of the expected working hours? Can you trust your manager to not treat your earnings and work ethic differently if you have a secondary income? Does the annual salary outweigh the competition's wages? And will the company match the money I save for at a 3 to 6% retirement rate? Does the company offer training and experience to advance your career? Are there opportunities for promotions written into the employee contract? Discuss and question annual PTO balances, FMLA, prenatal care, and holiday hours. Discuss disability support and healthcare benefits. Ask management what are the guaranteed qualifications to advance to the next tech title. Are there senior technicians willing to mentor new employees? Sometimes management will expect you to be trained on a certain modality before they will advance you, or multiple modalities. Some will most require you to have a minimum of like 2 years to go from a BMET 1 to a BMET 2. Once you're a BMET 2, a lot of that is dependent on the facility itself. Most facilities require stat work orders to be attended to within 30 minutes of you getting the call. So that means from the time you receive the call at your house, the time you were there on the floor, they are counting every minute. So a major thing you want to ask yourself when you're relocating to a new hospital is, how long is the commute from your home? And you want to include bad weather, multiple routes of transportation, construction, and traffic, because a lot of these calls will happen through the middle of the night. The weather can be inclement. You will get more calls based on bad weather because power outages will impact the most important equipment first. Some companies will reimburse or offer financial support with long distance moves. See how much the hourly on-call rate is, including holiday pay and time and a half. I'm sorry, I'm nervous, guys. So a big thing you want to keep in mind is what makes you happy in your day-to-day workload. So if you choose a smaller hospital, there's definitely good things. There's you have an easier time finding equipment because there's less places for them to hide. You will find Alaris pumps in the ceiling. You will find equipment in the trash. Linen will get mixed in with equipment, and the housekeepers will throw out tele boxes and smaller devices. So the smaller the device is, the more difficult it will be to find it on a CNL record. A smaller facility will guarantee less PMs in a month. In smaller areas, there's less competition for training, and there might even be incentives. If you are to move there, they might give you a sign-on bonus. It's easier to familiarize yourself with the staff, and a lot of senior nurses tend to not have the higher turnover rate because they have less traveling nurses there. Smaller hospital cons are there's less staff for support. So if it's through the holidays and there's no one there, you just kind of have to figure it out. There's less equipment and storage. So if you see a device that's aging, you'll find that that repair tends to be more common. So before you know it, you might be completely out of the equipment because they are all waiting on the same part. Rural areas can also struggle to afford replacing older equipment. The hospital I work at currently has a 15-year-old telemetry system, and even GE's vendor support cannot believe how old the entire system was. The servers, the power supplies are all from 2008. Larger hospitals, there's definitely an advantage to having more equipment there on site. You will have a less frequent on-call rotation. So if there's only 2 techs, you're on call every other week. If you have 6 other techs with you, you'll be on call every 6 to 7 weeks. So if you like your freedom, definitely try for a larger facility. A larger inventory of equipment is more forgiving with repairs and equipment shortages, and sometimes the larger facilities will have to loan their equipment to the smaller ones. The cons to a larger hospital is that when you do get a stat call, it tends to be more serious. More patients will be affected, and at times it can be challenging to, there's more things that can go wrong. There's more servers that can go bad. There's more access points with antennas and stuff. So it might be harder to diagnose and separate out what is working and what isn't. There's a higher cost of living in cities, and so you might find that a smaller facility will pay you less and you're actually in a more lucrative place. It just depends on the growth of the city. Here is a list of devices that will individualize your skill set and advance your career once you receive training. And these are separated from imaging. So these kind of devices will help you slowly work your way up to imaging or just help you promote to the next level as a BMET. Ventilators are a great one. Anesthesia machines would be the next thing to be trained on after ventilators because they are basically a large ventilator with gas. Heart-lung machines and balloon pumps will definitely advance your career. You do want to be introduced to life support before you take on cardiac life support. Telemetry monitoring is more forgiving than heart-lung machines and balloon pumps, so your manager is more apt to familiarize yourself with the tele boxes, the PMs on a telemetry unit. Even the servers themselves require PMs, and so you'll need to get the login information for that. Cardiac stress test systems are another good place to start. You will most likely be maintaining a computer, a defibrillator that's correlating, and a treadmill. Contrast injectors are a good place to start if you are interested in imaging. ECMO machines are great to start if you're interested in getting more familiar with the ORs. If you're looking to see what devices to request training for, find what equipment is no longer supported by service contracts and warranties. This is specifically if you are in-house. If you are a third party and still working in-house, this can also apply. Being trained on critical equipment in-house will create a positive impact on the hospital, improve the quality of patient care, and advance your career all at once. Ask management to provide a detailed list of the scope of service that you are required to cover. A device is considered repairable until it's cheaper to replace the entire unit. Parts can no longer be ordered. The device is deemed no longer safe to be used in patient care, or the manufacturer ends service and sales on the model. You will see that equipment is getting aged out a lot sooner than it was 20 years ago, specifically with software. I always say that you have your PM, you have repairs, and troubleshooting is a very detailed duration of multiple repairs. And this is the most effective troubleshooting process. So you want to start with the fastest, cheapest, and most simple repairs first. Anywhere that there's basically hands, something that can be removed or added will most likely be the first culprit. So first thing you want to do is verify this was not user error. The nurses will tell you any story that they want you to believe, and oftentimes it's just simply not what you will find wrong with the device. So you want to check consumables. Anything disposable or easily replaced will wear out more quickly and will take more damage. Environmental conditions such as bad outlets, wall ports, and external damage can sometimes make a device act strange, and it's a simple fix. Electrical components such as dead batteries, power supplies, power cords, and components on a board correlating to the display can be damaged. Okay. At the beginning of my career, I created the concept of TechNation portfolios with the goal to build my portfolio with the growth and knowledge of my everyday tasks. Portfolios can consist of notes, resumes, templates for work orders, part lists for devices, and many more important documents. Any collection of online and any information that you create online, you should definitely keep a copy on a personal laptop. These notes should be easily accessible to increase the speed of PMs and repairs and keep them uniform. Use a standard checklist that is OEM approved within the notes of every device. Copy and paste the service notes template and checklist into every work order with the device's individual results. Your personalized collection of information is a great demonstration to establish your willingness to learn and to challenge yourself. Templates uploaded to work orders allows for healthcare safety organizations to have a better idea of how PM processes work. So you might have someone from JCO actually sit down with you and question how you start your PM from the time you get it off the floor to the time you put the sticker on it and return it. And so having a written documentation to prove not only did I show them the entire process, now I'm documenting the entire process. And here is an example of some of my portfolio documents. I work on these every single day, and I add just as I learn, as I go. Before you remove equipment from patient care areas, verify that your biomed department has the proper test equipment, parts, and PM kits. I try, if I have time at the end of the month, to look at what my PMs will be in the next month and start ordering anything that I believe I'll need. Specifically, batteries are a huge one. Another thing to keep in mind is to install maintenance software if the device requires it for testing. And some software does require online courses that can or cannot be free. A huge component to make your life a little bit easier is to communicate with management to schedule PMs based on the amount of work for each month. That depends very much on your modality. The higher the modality is, the less equipment there will be and the longer the PM will take. So you want to organize this equipment by its type and its department sometimes. So you might have your PM month for ED only, or if you prefer that you get that same. If you have defibs across the entire hospital, maybe just focus on that for the month. Stay mindful of the length of time a specific PM takes and avoid heavy workloads around the holidays or at the end of the year. A lot of times you'll find at the end of the year you're playing catch up for equipment that was missed. You'll start finding CNL devices throughout the year. And so all of that will get tacked on when you want to take time off, of course. I want to thank everyone for their time. And if you have any questions, please raise your hand.
So when you're building your tech portfolio, is that a separate document for every single device that you're putting in the specific readings and you're making a copy?
Exactly. So normally what I do is for each device, I have like a Word folder, and then I'll make a separate Word document for each one. And so on each one, I'll have like the notes, the parts, the actual template itself. Sometimes I need a reminder, like a procedure can be pretty thorough. It might be 10, 15 steps. So I just make sure that any notes that I know I might forget, any friendly reminders, anything that if there's a certain part that I know notoriously goes bad, if I have that just right there, I can literally copy and paste that part number, put it into, I use RSQ since I work for Trimedx, and then have the part loaded onto the work order, have the template right there. And so it's all just everything you need to know about the device in one place. Thank you. Yep.
So you want to keep this information on a separate device, like a thumb drive or your own personal computer, in case your laptop gets damaged or you
Exactly.
should have to go somewhere else, then you're not stuck with all your stuff you left behind.
Exactly. This is your own individualized documents that you create. I try to not take things out of a manual directly, word for word. I try to summarize what they tell me to maintain the OEM expectations. And so if I do move on to a different job, then I can take this information with my resume and say that this is how I can prove I'm qualified. I had manufacturer training. I know the PM procedure like the back of my hand. I have written proof of it, and I created this to customize the best way to optimize my time, because you spend so much time typing the same thing over and over. If you have 700 Alaris pumps that you have to do in a month, and you have to type out something this long every time to protect yourself from the air logs having problems or something, it will take you 10 times as long to complete the PM. So that ability to just say, the care has been standardized. I know I ran the device through the same procedure, and I just don't feel like typing this out every single time. This will just save you from that trouble. Yeah.
From your experience, is there any companies that will help us grow our skills faster?
Truthfully, a lot of the larger companies just simply have more money. You'll find that they'll have deals with training programs and stuff where they get discounts. And so some companies do definitely, if they have multiple sources of income, like they make the parts, they manufacture devices, they have field service, they have contracts with individual hospitals, they tend to push training more because they want to, I mean, it's a business. They're trying to take other competition out. And so if you work for a small rural hospital that is not contracted, it's going to be a lot harder for them to afford training, because training can go from anywhere $5,000 to $10,000 plus dollars. They will sometimes have you sign paperwork that states that you will work the time allotted that will pay off the training. So if you do 34 PMs on the device you were trained on, that will pay off the balance of them expensing it for you. Each company has their own individual process of, some will pay for travel, rental cars, food, the training itself. Others will say that, we'll give you a stipend, you pay for your own travel, and we'll pay for the training. So when you are in the hiring process, you definitely want to question, how much are they willing to pay? Is there a certain limit amount of training that they will encourage you? Like, do they guarantee you 3 trainings a year? Will they not give you a straight answer? Will they say it's unlimited? As long as we see your growth, we're happy to promote that. I mean, it's very much based on their budget, truthfully, and how many technicians you're in competition with. If everyone needs that same training, you'll have to work around each other's schedules. They definitely favor technicians that have seniority. They will be guaranteed the training before you. So it's definitely hard conversations that you will get an answer you won't like, unfortunately. So